Good afternoon, everyone, and thank you for joining us. We are thrilled to bring you UC Davis's third Big Ideas virtual event. A new series of online events will be running weekly through early June. For those of you whom I haven't yet had the pleasure of meeting, my name is Mariel Hughes, Executive Director of Development and your contact for UC Davis. Many of you may be curious about how we're holding up in Davis and Sacramento. While we are staying safe, I'm happy to tell you that UC Davis and our health system have been working relentlessly to combat COVID-19. Our heroic healthcare providers have been treating and saving patients, running clinical trials, and testing new therapies, all while taking care of emergency cases. And now our medical center and clinics are phasing in a return to normal operations. The School of Veterinary Medicine, which we'll learn more about today, has launched a Q&A series on Instagram that covers a variety of topics, including vet med faculty insights on COVID-19. You can watch the recording of their first episode on the UC Davis Vet Med YouTube channel. Campus leadership is planning as we look to resume activities on campus when it is safe to do so, there are two key areas of focus: instruction for the fall quarter and overall operations. Campus leadership is planning how to do both safely and effectively, and we will keep you posted as decisions are made. Until then, we are glad to have this opportunity to meet with you virtually. If you have any questions during today's presentation, please type them in the Q&A box in your screen. After the presentation, I'll ask these questions to our speaker. We will also have a short poll at the end of the presentation, which I encourage you to fill out. I think that's it for housekeeping. Let's go ahead and get started. Thank you.
Driven by curiosity, passion, and ambition, championed by a community of supporters and the philanthropy of donors, the top minds of UC Davis have embarked on journeys of discovery, forging their own paths with transformative projects that will push boundaries, inspire change for generations, and provide solutions to the most urgent and critical problems in California and the world. Join us for an all-new virtual event and exclusive insider's view as we explore the many ways UC Davis is outgrowing the expected and how our cutting-edge ideas of today will become the impactful realities of tomorrow. Ladies and gentlemen, please welcome UC Davis Chancellor, Gary May.
Hi there. I hope you've invited your pet to sit in with you for our Big Ideas topic today. This big idea is all about them and you. One of the top points of pride at UC Davis is that our School of Veterinary Medicine is ranked #1 in the world in animal care, research, and education. With this big idea, we envision a medical center that will allow us to maximize and grow those strengths. Our new facilities will enable us to expand our care, research, and educational opportunities, leading to better health for animals and better lives for all of us. And I truly mean all of us. Our veterinary experts work on several nationally leading initiatives that impact both animal and human health. Project Predict works to counteract pandemic threats from pathogens such as the coronavirus and Ebola, which first infect animals before jumping to the human population. And our collaborative One Health initiative bridges the expertise of veterinary and human medicine researchers to find commonalities that can advance knowledge and care for both groups. I'm excited for you to hear about how the Veterinary Medical Center will support all of this work and more. Thank you again for tuning in today.
Thank you, Chancellor May. Now it is my pleasure to introduce Michael Lairmore, Dean of the School of Veterinary Medicine. Dean Larimore oversees all School of Veterinary Medicine teaching, research, and service activities, and presides over 6 academic departments. Dean Larimore is a scientist who bridges multiple disciplines to address basic questions related to viral causes of cancer. His research has provided significant breakthroughs in the biology of human retroviruses and the understanding of viral-associated carcinogenesis. He is also an expert in comparative oncology. Dean Larimore is one of the few veterinarians invited to the National Academy of Medicine. As champion of the Veterinary Medical Center Big Idea, Dean Larimore is leading the largest capital campaign effort in the history of UC Davis. This big idea will allow the school to expand its excellent patient care and advance leading edge research, applying novel solutions to complex problems affecting both animals and people. I'm looking forward to hearing details of this exciting big idea directly from Dean Larimore. Please join me in welcoming Dean Michael Lairmore.
Thank you, Marielle. It's my pleasure to be with you today and to describe for you our big idea, the Veterinary Medical Center. In my presentation, I will outline the reasons why UC Davis is at the forefront of veterinary medicine and contributing to a range of disciplines to solve some of the most complex problems faced by our society, including the current COVID-19 pandemic. Our big idea, the new Veterinary Medical Center, will extend our world-leading legacy through the creation of a center of healing, discovery, and innovation. The animals and people you see on this slide are actual patients and clients who benefited from treatments unimaginable back when the school was founded in 1948. I want to start today with a video that summarizes our vision for the project and the significant impact our people and programs have in our society and around the world. And importantly, why you are so important for us to realize our vision. I like to say when I come to work, I see a miracle every day. Our new Veterinary Medical Center is really a transformational project. It's designed to really change what we do on an everyday basis. It brings together multiple disciplines into a facility, into an environment that's creative, innovative, and really future-looking.
The construction of the new Vet Med Center is really exciting. What we find is that veterinary science, as a field keeps progressing, it's also necessary for Davis to expand and keep providing the top quality care that it's known for. And the new Vet Med Center will help us do that. And it's not just more space that we're talking about, but we're talking about state-of-the-art technology and all the brightest minds in vet med under one roof.
We're producing instruments in our hospital that are looking at modern technology to do whole body scans for animals that have metastatic cancer. We're using linear accelerators to precisely eliminate that cancer. We're working with the Comprehensive Cancer Center to take that technology and understand cancer in animals and in people as well.
The new Livestock and Field Services Center will allow us to update our facilities. So our first mission is to serve the agricultural community of California and help provide for food safety and food quality. And our second mission is to teach students about food safety, about livestock diseases, and also just about medicine in general and surgery in general and how to be a good veterinarian. And then our third mission is really to serve our clients and to provide excellent care and services to our animal-owning clients.
Our Equine Performance Center, which is a main part of our first phase of this project, really brings cutting-edge research technology really into the arena. We're going to be able to put force plate analysis, videography, gait analysis that allows us to, in slow motion and with very accurate detail, determine lameness of horses. The small animal clinic is really bringing together what we know we do on an everyday basis, which brings the latest technology of over 30 specialties into really advancing the care of our patients. On the small animal side, what this facility will really transform is bringing that into a cohesive unit. Donor support is absolutely essential, and at this time, particularly critical. We have strong support from this university, but we cannot go into the future without that donor support. We need that support to be able to make the future happen. It takes a special place to be able to achieve everything you saw in the video. You need top-flight veterinary and scientific expertise, advanced facilities, and collaborators across multiple disciplines. We're ranked #1 in the world and the nation for a variety of reasons. We have the depth and breadth of faculty and staff expertise dedicated to be top in their fields in veterinary education, clinical care, and research innovations. Our students are highly selected from among a rich pool of candidates, and our alumni are leaders across the world. We promote transdisciplinary approaches to solve societal needs with willing partners within a comprehensive and supportive university that includes a renowned School of Medicine and colleges of agriculture, environmental sciences, engineering, and biological sciences. Innovation has been happening here for years, and with the recent advances in scientific and medical knowledge made possible by the revolution in digital technology and data sciences, our pace of innovation is accelerating. In the next series of slides, I will demonstrate how we are addressing societal needs in numerous ways that benefits animals and humans and planetary health. As you would expect, one of our primary missions is to offer cutting-edge treatments to heal animals, including your family pets. You may not know that when our veterinary medical teaching hospital opened in 1970, it was designed to serve 3,000 patients a year. Today, we educate the next generation of world-class veterinarians and specialists while serving 50,000 patients a year who come to us from all over California, throughout our nation, and even from other countries to receive the advanced care and benefit from our clinical research and our specialists in over 30 disciplines, ranging from veterinary cardiology to oncology. Our renowned clinical and research training programs develop leaders from across the world, impacting multiple fields of science. Our faculty train graduate students in fields ranging from epidemiology to immunology, funded by competitive grants from sources ranging from the National Institutes of Health to biomedical industry. We have one of the largest veterinary student summer research programs in the world, allowing our students to work alongside our faculty in basic research to translational medicine. We collaborate with experts in human medicine, engineering, biology, and others. For example, in collaboration with the UC Davis College of Engineering, we were the first to successfully produce and use positive emission tomography, or PET scanning, on a standing horse to diagnose lesions. The ability to utilize this technology on a standing horse under sedation instead of general anesthesia will greatly expand the availability of this powerful imaging technique to prevent breakdown of horses on the racetrack. Our work not only helps animals, but also benefits people. An example is our research using stem cell therapy and regenerative medicine, developed in veterinary medicine for many years to treat disorders from musculoskeletal injuries to chronic inflammatory disorders. To extend our impact, we've developed a Veterinary Institute of Regenerative Cures that, among the variety of studies, is exploring the use of stem cells to treat spina bifida, a crippling congenital defect that occurs in certain lines of English bulldogs and children. This work has shown promise and is done collaboratively with parallel studies with our colleagues in the UC Davis School of Medicine's Institute of Regenerative Cures for Humans in Sacramento. Our mission seeks to advance the health of animals, people, and the environment we all share. This is called a One Health approach, and it has its origins in our school and is a guiding principle that allows us to address global issues. For example, our CDC-funded Pacific Southwest Center for Excellence for Vector-Borne Diseases brings together a diverse group of professionals to address urgent public health challenges from the spread of pathogens transmitted by mosquitoes and ticks. This same group recently used their skills to develop a new web app that features interactive maps and graphs, allowing users to get a simple comparison of COVID-19 trends over time and track COVID-19 cases by country, state, and even at the county level. Our scientists in our One Health Institute helped build a global infrastructure for monitoring and preventing human pandemics using a One Health approach. This effort have allowed our scientists to understand the origin of many zoonotic pathogens in their natural reservoirs, including SARS-CoV-2 from bats, the cause of the current COVID-19 epidemic. By knowing the genetic sequence of these viruses, diagnostic tests were developed at record speed to document the worldwide pandemic. Researchers at the Center for Immunology and Infectious Diseases, a joint research center sponsored by the School of Veterinary Medicine and the School of Medicine, were quickly mobilized when COVID-19 struck Northern California. They utilized their specialized high-level containment laboratories to grow SARS-CoV-2, the virus, to increase capacity in diagnostic testing, and provide the virus for researchers at UC Davis and other institutions. The COVID-19 pandemic and the subsequent shelter-in-place policies and its negative economic impact have dramatically demonstrated our dependence on an interconnected food supply. You may not know that our school hosts the California Animal Health and Food Safety System, consisting of 4 laboratories throughout the state, through a strong partnership with the California Department of Food and Agriculture. This system is constantly at work to ensure our food supply is safe and secure through collaborative networks to test for foodborne pathogens. Along with our Western Institute of Food Safety and Security, the Veterinary Medicine and Teaching Laboratory in Tulare, and our Livestock Medicine and Surgery services, we educate the next generation of veterinarians who work in agriculture and public health to protect the state's and the nation's food supply and advance the standards of food safety and security across the globe. We also provide leadership training and treatment to respond to disasters in Northern California. This is a photo of our animal rescue efforts during the series of fires in Northern California over the past several years. We provide animal disaster training for our veterinary students and collaborate across the state and across the world, setting the standard in animal disaster relief and recovery. Another example is the Oil Wildlife Care Network, a key program in the state, in the school's Karen C. Dreyer Wildlife Health Center that provides regional, national, and international readiness and response activities to oil spills throughout California and collaboratively throughout the world. We share our knowledge, both within our communities across California, but also around the world. In doing so, we are utilizing our unique position as the only school of veterinary medicine in the UC system to link multiple disciplines to address pressing issues faced in our society. We have the expertise, knowledge, and skills needed to serve at the interface of animals, humans, and the ecosystem. So you can see how UC Davis is transforming veterinary medicine through a comprehensive One Health approach to address societal needs in advancing animal, human, and planetary health. I hope my presentation illustrated, albeit briefly, how our vision to build a comprehensive veterinary medical center positions us to advance our science and clinical treatments to benefit the world. Our impact is truly global and is illustrated when we map the location of our alumni across the globe. From our graduate programs to our specialty training programs, our people are impacting their communities throughout the world. The photo on the right is one of our students performing research in Africa to understand and prevent the spread of Rift Valley fever in Tanzania while obtaining a global education. We are training the next generation of veterinarians and scientists that are trained here locally to help animals and people around the world. Our vision to create a veterinary medical center will propel us into the future and will be like no other institution of its kind. Now, we recognize that our big idea is bold and our fundraising campaign is ambitious, but we also know that our vision is taking shape, and we've made significant progress in the past 3 years and are now building the first phases of the project. This year, we completed the large animal support facility and the blood donor animal pasture and corral. In addition, I'm excited to announce that we have achieved our fundraising goal for the All Species Imaging Center, and construction starts next year on this advanced center described earlier in the video I showed you. We are currently focused on fundraising for our Equine Performance Center and our Livestock Services Center. We will then turn our attention to fundraising to complete the Equine Surgery Center and the Small Animal Hospital, a project to be completed over the next 10 years. As I mentioned at the beginning, at the core of what we do are the patients and clients who benefit whenever we discover something or develop a new treatment. This is who motivates us. We've learned today about the unique role of veterinary medicine and see why UC Davis is at the forefront. We are bringing animal health to a whole new level, while also making important contributions to the revolution in human health. A center of this magnitude cannot be built with patient revenues, state funds, or other ancillary sources. We need donors with the vision to partner with us. There is much more that we can do with your support. I'm happy to answer any questions that you have today.
Thank you, Dean Larimore. Before turning it over to questions from the audience, I was wondering how current hospital operations are coming back online after the shutdown.
Oh, thank you, Marielle. It's my great pleasure to be with you today. And our hospital is, like all of our facilities on campus, really operating with the public health in mind, and that includes all of our people. And so we have restricted the operation to emergency and critical care and emergent services. Having said that, we are, like the rest of the state, starting to open up and offer those services in other aspects of our operations, and are planning for that to do that in a safe and effective way.
Mm-hmm. Excellent, thank you. Can you talk a little bit about the projects that are part of the phase 1 for the VMC and kind of where you are to date from a fundraising perspective?
Yeah, we're very excited. As I mentioned in the video, we've already completed a couple of the projects, including the livestock support facility and the donor pasture project. So those have been completed, the funds have been obtained, and we're have constructed those. So we're excited about that. I think we're very excited. We're in the detailed design phase of the All Species Imaging Center. And as mentioned in the video, that's a central part because imaging is so critical to everything that we do, from looking at advanced surgery to any kind of diagnostics. Imaging today is important both in medicine and veterinary medicine. So we started with that project, and we're very excited with the response that we had. The whole project is about $23 million, and we've raised the money for that through philanthropy. And we're excited that it's in the detailed design phase. It'll go out for bid next year and start construction next year. So that'll be the next phase. And then, as I mentioned, then we're going to turn to the Livestock Services Center and the Equine Performance Center. And both of those projects are very exciting, and we're underway in both of them.
Congratulations. Yeah, I know that's great progress. So a couple of follow-up questions about the physical facilities. So question about geographics of the new imaging center. It looks like it's going to be between the horse barns and the vet med teaching hospital where the horses get examined currently. So what's going to happen to the horse barns, and how will you make up for that loss of space?
Yeah, that's a great question. We thought of the same thing. One of the things that we considered early on in the design many years ago was whether we should build a whole new hospital separately. As mentioned in the video, we opened the hospital in 1970 and had the expectation for around 3,000 patients per year. Well, we've grown since then. You know, we have over 50,000 patient visits. And with that, we needed to expand. And over the years, it's expanded within that physical facilities or physical space that we had. So when we designed the new all veterinary medical center, we realized that during the course of the last 2 or 3 decades that we've become spread out. Many of our facilities are separate from each other. Some of those are functioning very well and have excellent services, but they needed to be interconnected. So one of the things that we needed was to have those services centralized. So for imaging, as I mentioned, because of its importance, both for large and small animal, we needed to put it in the center of that campus structure. And so as a consequence of that, we needed to move some of the other facilities. So with that, it's a phased-in design. So some of the current horse barns or storage facilities will be moved to other locations during the construction.
Great, thank you. Does the All Species Imaging Center have applications for remote imaging for zoo animals that cannot be transported to the center?
Well, you know, it's interesting. Radiology is one of those services that went digital many years ago. In fact, many of our operations are, we transport the images digitally, and they're read out by our specialists, and they could be read out in any number of locations. But the actual machines themselves, the large ones, the very specialized ones like positive emission tomography, those aren't really mobile, and those have to have a facility like this. Now, in the cases where we have to go into the field, such as a zoo animal, we actually have a hospital at the Sacramento Zoo, which we man, and we have imaging instruments there. And then the images can be transported electronically or digitally, and then read out by our radiologists here on campus. So we do have some mobile opportunities as well in the field. The same would be true for large animal species such as a cow or a horse in the field.
Mm-hmm. Great, thank you. So this is not directly related to the facility, but a question about what are the other leading public research universities in the world with strong One Health, veterinary medicine, agriculture, human medicine programs? And are there partnerships between UC Davis and these institutions?
That's a great question, actually. There aren't that many that have the comprehensive nature of all of those disciplines in one facility like UC Davis. There are a few, though. I came from Ohio State University, and they have a medical center and a veterinary center, pharmacy, and nursing, et cetera. But what we do with those is very often collaborate. And I really like the question because very often advances are made through collaboration. Much of our advancement in treatments, our clinical trials, our efforts in research are interconnected. And so many of our colleagues at much of those university sites, such as the Mayo Clinic, it could be at Cornell, it could be in other locations, are collaborative. But there are few that have the comprehensive transdisciplinary nature of a campus like ours.
Mm-hmm. And as a follow-up question to that, how will the new facility coordinate these global partnerships, and how will it enable stronger partnerships going forward?
Well, a number of different ways. One is just locally here on campus. One of the things that the new facility will really advance is the ability to bring other disciplines in. I mentioned engineering, a very important partner. We have collaborated with bioengineering for many years, and our engineers are right next door, but sometimes we need the facilities to bring them in. So, for example, in the All Species Imaging Center, we have built a suite which is for prototype instruments. That means that we're beta testing or early testing of instruments that are just being innovated, much like that positive emission tomography of the horse, the PET scanner. That was really an instrument that was designed originally for people, but we were able to bring the engineers. So the new facility will allow that to be done in a much more efficient fashion. Then when it comes to outside collaborations beyond our campus, you know, these kind of facilities draw in the best talent from around the world, and they want to work with us. We often are contacted by places such as Stanford, UCSF, and they want to come to work here in part because we have the unique skill sets that complement and expand what we can do in what we call translational medicine, which is discoveries which are directly translated to something that would be used both in animals and in people.
Great, thank you. So do you expect the COVID-19 pandemic to result in additional support from the state to support these One Health initiatives?
That's another great question, obviously on our mind as well. So as we're responding to a pandemic such as COVID, you know, we were funded through federal networks such as mentioned in the video through the United States Department of USAID, Agency for International Development, for example, or NIH. And these kinds of federal funding, which allowed us to be at the cutting edge of that research to start with, where we're looking for reservoirs of the virus, building capacity around the world, those were well funded, some of our larger grants to start with. So what we expect is that work will continue. One of the exciting projects is called the One Health Workforce Grant, which is already funded and operation in both Southeast Asia as well as in Africa, forming networks, capacity building. These are the very labs that we helped build out in the PREDICT project. and are now at the front edge of testing for COVID in those countries and around the world. So that network will continue. What I expect is exciting things that are both stimulated here on campus. We have pilot projects that are already funded to do COVID work, bringing our veterinary specialist, our pathologist, into the arena, so to speak, working with people in medicine, agriculture, engineering. So these projects are funded sometimes with pilot grants. They're sometimes funded through philanthropy, and then they lead to larger grants in a federal grant. And we expect the state to be a continuing strong partner with us.
That's great. So you've kind of already touched on this, but I did get a question. Do you expect animal-human virus research to be an area of emphasis and growth for One Health and the VMC in the future?
Well, I think it's interesting. It's part of my DNA. The reason I got into research was the AIDS epidemic, and I was a veterinarian studying sheep viruses when I was called in to studying human viruses back in the early 1980s. So it's near and dear to my DNA, but I really think that what you see is a continuum. We've always been here. We've always been studying animal viruses, whether it's viruses that affect just animal. In fact, our school was formed in 1948 because of the state's demand to combat some of these same kinds of infectious disease epidemics in animals. So that's always been there. What I think we've observed is over time, as people begin to encroach upon the environment and wildlife and some of the biodiversity issues that we face on this planet, we face more and more of a threat and spillover. And the spillover means that we're going into natural habitats, and our wildlife veterinarians are at the forefront of that, who understand how the animals live in their environments. When we do that as people, we sometimes bridge into areas where their diseases may be transmitted between animals and people. And by the way, we can transmit back to them as well. So it goes both ways. But we've always been there, and so it will continue. In fact, I think it's even going to be more critically important. That's why these kind of facilities are important, because they bring people together. They bring our researchers together with our clinicians. They bring other disciplines together to solve some of these big problems that our society is facing.
Mm-hmm. Excellent. So the next couple questions are more related to clinical practice and training. So first question, where do you see the majority of your equine clientele coming from, and what are some of the problems that are presented?
Yeah, our equine, California and the West has identified with the equine or horses since the beginning of society in California. So they've always been part of our society, and they're very important, both for people, both for pleasure as well as on the racetrack. So it's a very important part for a school like ours. We are the only veterinary school within the UC system. We have long had a strong history in equine medicine and surgery. We had founding members that discovered major diseases of equine, invented or refined surgery procedures, etc. So we've had a strong foundation. So our clients come to us both from California, certainly Northern California, and they're horse owners, and they need our help. They need our help in a variety of ways. One of the things we're doing right now is through the imaging center is developing techniques to find early injuries in horses before they even actually show some clinical signs such as lameness. That prevention part is critical to allow them to be rested and properly cared for, so they're not overly used by their owners. So our clients come from California, but they also come throughout the Western region. So we collaborate throughout the West, from Colorado to Oregon to Washington. And these are colleagues that are both at universities, but also in private practice as well. So they come from those regions. But we're also a quarantine center for diseases that horses might have on the West Coast. So our Center for Equine Health, for example, which is part of our Equine Performance Center, they're really the facility to help promote research on horses, to help a horse battle some of these infections and diseases. but also to help heal, layup facilities, for example. And because of the fact that we are an international center, any horse that comes into California sometimes have to be quarantined here. So we have specialized facilities for that. So they come both locally as well as globally.
Great, thank you. Where do you think the next big advances in veterinary oncology will come from?
Cancer is critical in humans. That cancer research, that discovery of new treatments is critical both in animals and in people. Many people are surprised sometimes they'll sometimes ask us, do animals get cancer? And of course the answer is yes. They're like us. They're living to older ages. They have the same environment as we do. In fact, in some ways, our pets can serve as sentinels for our environment for things that might cause cancer. So oncology treatments go along in the veterinary field along with the human field. As mentioned in the video, we're partners with a comprehensive cancer center in Sacramento at the School of Medicine. That's a very important partnership. So what that means is we have a unit called comparative oncology. So we compare what is happening both in the cancer incidence, what type of cancer, but also in what treatments work against cancer. So in our clinical trials, what we'll do is we'll often design those with that interest in mind. So we'll have treatments that help both animals and in people. So when we're collecting and helping our clients, our pet owners, and with the very best treatments, we're actually looking at that with mind to compare data, compare with our oncologists at the medical school. And in fact, much of our data has been used to advance medicines or treatments or therapies in both animals, but also accelerate the treatments in people, saving many years of development and many dollars from the pharmaceutical side, for example.
And a follow-up question to that, how does the School of Vet Med liaise with the medical school infectious disease division to expand research on infectious disease and clinical research?
Well, they're critical partners. We often have laboratories, so it could be at an individual faculty laboratory level where faculty from medicine and veterinary medicine are working together with common interest. Some of these are centered around agents, so they might be studying the same type of virus, for example, and they naturally get together. What we do is we stimulate those, again, with pilot funds, philanthropy funds. This is where philanthropy is critical to ignite that interaction and bring them together. The facilities I described in the Veterinary Medical Center are really designed to bring and have a facility, because you can do all you can to promote their interactions, but if they're not together in a modern facility, sometimes the research doesn't advance. So we stimulate them to be together. So it could be at the individual faculty level. It also could be programmatically. I mentioned these larger grants, these federal grants, where they're around a human outcome, a National Institutes of Health grant, for example, but our animals are really leading the way in terms of helping them understand mechanisms or helping them advance a treatment. That's where you also see a lot of interactions. And then finally, we go there back and forth between the medical school and the veterinary school for things that are like rounds, joint rounds. We'll have our faculty involve patient care, talking about their patients, what can they learn from each other. And that's not only in cancer and infectious disease, but in many other disciplines. We have over 30 specialties within the Veterinary Medical Center. And those specialties, often from ophthalmology to cardiology, are working with our medical colleagues.
Mm-hmm. Thank you. There is said to be a critical need for food animal vets in underserved and/or rural areas in the U.S. What specifically is UC Davis doing within the curriculum to address the clinical service delivery or economic constraints?
I think that's a great question, and I'm really happy that was asked, actually. I started as a dairy practitioner right out of veterinary school. I spent 2 years in dairy practice, really enjoyed it. I wanted to be James Herriot, by the way. Many of you may know who that is. The need for veterinarians in rural areas and in large animal medicine is critical, as the question implies. The reason that we understand that is that we're actually actively in multiple different ways educating the next veterinarian. I mentioned some of the larger programs that we have, such as the Western Institutes of Food Safety, our California Animal Health and Food Safety System, which is 4 laboratories, one in Davis, one in Turlock, one in Tulare, and San Bernardino. These are all laboratories that require veterinarians to be at that cutting edge of diagnostics, but we also need them in the field. So what we're encouraging in our recruitment is recruiting from those areas. We know if we can recruit veterinary students from the rural areas of California, they'll often go back and practice there. So our recruitment, our pipeline programs are designed around that. Then when they come here, we have things like our Food Animal Club. This is a student club, it's one of the largest, that get involved in specific projects to talk about how can they learn together, wet laboratories to learn better techniques. And then we put them in the field, not only through our curriculum, but also with practicing veterinarians through our early bovine exposure program. Again, that is made possible from philanthropy. So it starts all the way from the early pipeline program all the way to the support of the veterinarians that are beyond us and have already graduated.
Mhm. So I've got a second question related to agriculture. Given that anytime animals are crowded together, transmission and mutation of viruses is facilitated, increasing the chance of jumping to humans, whether it's live animal markets in Asia or CAFOs in the US. Do you think there will be any consideration in the future to deconsolidate animal agriculture? And how will it be possible to do that and still feed millions of people economically?
That's a great question, and something that we're actively involved in at multiple different levels. So really it comes down to, we know that animals that are brought together for whatever management reasons are more likely to transmit. Just the same thing as that we're finding in this pandemic for COVID. The more physical distancing we don't have, the more likely you're going to be to transmit a disease. So in agriculture, there are very strict procedures for a lot of the commercial operations in which their biosecurity is critical. So, for example, they don't allow visitors onto the farm. They don't allow trucks to come in and out without being sprayed down. These are biosecurity procedures that we are actually training for. So we have work with our agriculture and natural resource system as young as 4-H students, learning about biosecurity and the importance of that. So that's one way, is to make sure the animals that we are growing for the animal protein sources that are needed to feed the 9 billion people on our planet by the year 2050. We are an important source for that, and many of those animal source proteins are critical to prevent childhood stunting, which we see in these areas of the world that can't grow their own food, and they can't live on just plant-sustained products alone. So it's a combination of thinking about it from that context. In addition, it's also thinking about it from the production of vaccines, preventing diseases. So we've always been at the forefront of trying to prevent disease through vaccination. It includes humane management, animal welfare issues to reduce the stress of the animals. So for example, in our livestock center that I mentioned in the video, we actually are working with people like Temple Grandin, many of you may know from her movie, in which she really understands animals from the animal welfare perspective to reduce the stress. So even in the facility design, you can design those to reduce the stress of the animals. Non-stressed animals are less likely to transmit disease. So it involves multiple ways: biosecurity, vaccinations, and treatments. Now, on the spatial side, yeah, it's true that a lot of our effort could be also directed towards farms that are modeled in different ways. One of our agriculture specialists is really looking at pastured farms. And these are raising chickens in smaller groups in a pastured but controlled environment to help on biosecurity, but in a way that allows those animals to space out and then monitoring disease. So the key is to raise the food that we'll need to feed 9 billion people, but do it in a safe and humane way.
And I think UC Davis is really well positioned to do that.
Mhm.
So the next couple questions I want to ask you involve more the student experience. So will this new center allow for or create the ability to have an increase in the number of students who are studying veterinary medicine?
Well, certainly there is a need, as we talked about earlier, for veterinarians in areas such as rural veterinary medicine. I think the facility is really designed to enhance their experiences in a couple of different ways. One, it's better facilities for learning, modern facilities to help understand animal welfare. We're training the next generation of veterinarians to take these practices from UC Davis out into the field. So that's one way. The other is being able to bring the experts in to really have the modern techniques, surgery, for example, the imaging techniques available to them so they can really understand through their educational, through the curriculum, what are the most cutting edge techniques, what are the most cutting edge ways that they can be veterinarians and contribute to the future. And so the facilities are designed in such a way to enhance that mentor-teacher relationship and to be able to enhance the client experience as well. When they come to us, the students can see and interact in modern facilities to allow them to take the best care of the animal, but also have the best interactions with the client as well. Be able to observe surgery, for example, not behind a wall, but through windows. Be able to conduct safe examinations of the animals without worrying whether the animal could escape, or being able to handle them in a humane way. And these facilities have all of those in the design principles.
So I think that interactive hands-on piece is so important for students to gain while they're at the school. Um, Tell me, with the COVID-19 restrictions, how are you managing to provide these experiences both to students who are graduating, but also, you have a new crop of vet med students coming in the fall. How are you going to address hands-on learning, treatment, overall patient care?
Well, the faculty have been remarkable. The faculty and the staff have really responded to the COVID epidemic and changed our entire curriculum, as much of higher education has. So, for example, in the lectures, we already recorded all of our lectures. We have programs that record it and make it available to the students so they can go later and review the lecture or compare that to the notes that they've taken. So those are ongoing. So we have a lot of online learning going on. I think in terms of the physical distancing, what we're looking at is changing the way we deliver the educational models. And so you can actually have a small group laboratory in an anatomy setting, for example. It's spaced out a little bit more. We may have them on tables 6 or more feet apart, but the learning doesn't change. We have computers at each of those tables, for example, that can show the dissection from a single instructor at the front of the building or front of the classroom. Those are all examples of technology that we can build into these facilities, and we already have. So one of the things that also is we're looking at new ways to teach, virtual reality. You can do a lot with virtual reality, and we're working with our colleagues across the West to look at some of these new techniques for teaching. And then importantly, measuring those. So the quality of the education will remain very high, and the delivery at the end of the day is to make a competent veterinarian that is ready to go into practice.
Absolutely. And it seems like now more than ever, having additional space is going to be really critical for educating these students.
And the right kind of space, for sure.
Mhm. I also got a question from an attendee. How is the vet school dealing with the impact of depression and suicide in veterinarians?
Yeah, it's a very important issue, and in particular critical for veterinary medicine. One of the sad statistics is that veterinarians do undergo pressures which have been identified, such as student debt, such as the fact that many times while we're compassionate caregivers, we may be in a position where we have to euthanize our patients. These are stresses on veterinarians that are unique. And because of that, we do have a higher suicide rate among the health professions. So what we've done is a comprehensive approach, starting many years ago, actually. We have our own mental health counselors that are embedded within our campus, actually, that are devoted to our veterinary students. So they have access to counseling. We have a wellness club. We have a variety of staff that are devoted to wellness and health. And so part of that begins at the very earliest stages of their education. We also work collaboratively on wellness summits nationally, and that's where our colleagues get together to learn best practices. In fact, I had a phone call yesterday about that through our AAVMC, in which I was president of last year. And we've hired our own wellness specialist at the national level as well. So all of this in part is to get the tools and training of how they can use their resilience. And it's particularly important right now because you can see the stress of isolation on all of us. We're all getting really good at Zoom, but we're also getting, stressed. And in that everyday life of a veterinarian, to be able to have them acquire the skills that they need to be able to handle that stress are critical part of their education as surgery and other skill sets such in medicine. So it starts both with their support, it starts with their training, and it starts and doesn't end after they go into veterinary practice. On the student debt side, we are very fortunate to have a very strong philanthropy. We give out over $7 million in scholarships. What that has done is a very good statistic, which is our debt to income ratio, which is one of the best in the nation, if not the best, meaning our students are coming out of school with less debt than they did in the past and are really earning more salary. So in California, it's the ratio of that is looking good for UC Davis students. So as we give out more scholarships and grants and aid, that relieves the debt on them, and that is a huge stress for those going into practice. So we're really concentrating on that, and I've personally been involved in that. My wife and I have our own endowment for student success. So philanthropy plays a critical role in student scholarships, and we're very grateful for all of the donors who have contributed to that. So reducing student debt load, the resilience training, the wellness training, all of that comes together to support our students.
Thank you. That's a great thing to keep in mind as we think about new students coming in and really easing that debt burden. I know that you all are doing really creative things to help ease that stressor. So I've got a question regarding equine, kind of circling back to that. Are there any new breakthroughs in identifying causes or mitigating racehorse breakdowns?
Yes, I mentioned one of those, which is the imaging advances in the positive emission tomography. That was developed in part to detect lesions that we couldn't detect with simple x-rays or other types of CT scans, for example. So one of the important things is to prevent the injury from happening that we call catastrophic. So we have a program that's in collaboration with the California Horse Racing Association to look at new techniques for that. I'm very happy to say that a lot of those imaging techniques that were just in the innovative development phases a year ago are now on the track, and they're being used to screen the horses. And when you look at that, the idea is to identify early on those very active lesions that were shown in that video so that the animal can be rested, the animal can be treated before they even get onto the racetrack or reduce their training. It's like any other athlete. They need to have the right nutrition, they need to have the right environment, and they also need to have early diagnostics. So the equine athlete is very similar to the human athlete. Prevention is the key.
Mm-hmm. Thank you. So we are just about 4 minutes away from the webinar being over. I would like to get one last question in, but for those of you who are listening in on the webinar, we will begin the poll right now. So you'll see that pop up on your screen. But I'm also going to ask Dean Larimore the question and see what he has to say. So Dean Larimore, can you briefly discuss the work on FIP, which is a coronavirus by Dr. Peterson, and treatment, possible vaccine development that might relate to COVID-19?
Yeah, it's a great story. Niels Peterson is really one of the icons in the field. He has studied feline infectious disease for over 50 years. and discovered feline immunodeficiency virus, which is the feline AIDS retrovirus. But also he studied and has devoted much of his efforts to feline infectious peritonitis, which is the coronavirus of cats. And that causes a lethal disease in some cats that can be very problematic to treat. It's very difficult to treat. So what he's done is really looked comprehensively with his colleagues, Dr. Murphy and others in our school, at are there other forms of treatment. And he was very early on a pioneer in working with groups like Gilead to look at some of the drugs that you see, remdesivir, for example, in cats. And he's been using those in cats with FIP and published on those well over 2 years ago and showed that they were effective. It's interesting now that remdesivir is, of course, one of those drugs that's being considered in clinical trials for humans. That's a great example of how we've identified the commonality between cats, in this case, their viral diseases, and potential treatments that have been able to help animals and in people.
Mm-hmm. Yeah, a lot of really amazing research being done at the School of Vet Med and in partnership with many other areas. I also would be remiss to leave this webinar without congratulating you on once again being the #1 vet school in the world. That's quite an achievement, and I know it's you and an army of faculty, staff, students, and clinicians who make it possible.
It takes a village, Marielle, and we have a great village.
Thanks. So thank you, Dean Larimore. Thank you, audience members, for all of your great questions. If you are interested in learning more about the Veterinary Medical Center, please feel free to contact Hamie Sevening, Assistant Dean of Advancement at the School of Veterinary Medicine, whose contact information will be on the screen shortly. Oh, there it is. We could not get to all the questions, so we will also be reaching out to each of you who didn't get your question answered to give you some responses shortly. We could not do all the work that we've spoken of today or do it so well without private philanthropic support. With your partnership, UC Davis can have a positive impact on the student experience, on the interdisciplinary fields we touch, on society, and on the planet. Although we couldn't gather together in person, I want to express our gratitude for each of you for taking the time to connect with UC Davis. This is the 3rd virtual event of our Big Ideas webinar series. Our next event will feature healthy aging in a digital world. It'll take place May 20th from noon to 1 p.m. Pacific time. The webinar will focus on telehealth and care for aging adults, which is especially relevant in this time of COVID-19. Please make sure to register if you are interested. On behalf of the university, we hope that you are all staying healthy and safe, and I look forward to connecting with you again. Thank you again, and take care.